Okay, hi everybody, welcome. We're just admitting people. There are quite a few joining still, and then I will introduce Deborah Stodel, who will be presenting tonight. Thank you. Right. Okay, I'm going to do an introduction to introduce you to Deborah Stodel. For those who don't know, I'm Debbie from the Academy for Adults with Autism. This evening, we are considering communication and language, how we can help and understand the autistic individuals that we are supporting. Welcome. What I need to say as well is if by any chance our session ends and we are not finished, which is probably going to happen, please rejoin the meeting. It's a recurring meeting and it's quite easy to rejoin using exactly the same meeting ID and passcode. Thanks very much. We aim to finish at around about 7 o'clock at the latest. All right, so we have been hosting a series of talks, which has been really interesting, and we've had a good response. This evening, Deborah Stodel is giving another talk. It's her second talk. So some of you may have been with us on the earlier talks. I'm going to introduce Deborah. Deborah graduated from UCT as a speech therapist and audiologist in 1988. She worked at Red Cross Children's Hospital in Cape Town and then at the Johannesburg General Hospital's Child and Family Unit. In 1994, she graduated from Columbia University, New York, with a Master of Science degree in Speech and Language Pathology. On her return, she worked as a speech and language therapist at Vera School for Children with Autism. She did part-time lecturing and tutoring at the University of Cape Town and started a private practice in 2001. Deborah has run social groups for teenagers and adults with autism and has been registered with Autism South Africa as a recognized quality service provider for people with autism spectrum disorders. Her speech therapy practice offers the services of assessment and treatment of people with communication difficulties, with a special interest in autism spectrum disorder and intellectual disability. And I'm going to hand over to Deborah now. If you have questions, you may post them in the chat box or email us. Thanks, everybody. Thanks, Deborah.
Hi, everybody, and welcome. I'm going to just start. The first slide is just how our talk is going to be structured. And what I really love about doing this particular talk is that these were the topics that parents chose. So those are the areas I will cover. Communication, which is the more theoretical aspect. Reaching through autism and looking at the world through their perspective and how you can help. So let's start with communication. To effectively communicate, we need to realize that we are all different in the way we perceive the world and use this understanding as a guide to our communication with others. Now, if we look at the communication difficulties in autism spectrum disorder, they are vast. And if we look at communication, it is a highly complex function, but luckily it does have many different forms. And that's very important to remember with nonverbal people. If I had to explain to you how we produce speech, just in perhaps three levels, we access words or sentences or sounds for meaning. And if there's a breakdown here, we call it aphasia. If we have problems forming the movements to produce sounds, that's motor planning, very common in autism, and is called dyspraxia. And you can have that in your whole body where you just can't manage to plan your motor movements. And the third area is dysarthria, which is low muscle tone. And people with autism generally don't have low muscle tone very commonly. So we first look at the speech and articulation difficulties. In some people with autism, they don't have these at all. They speak perfectly. And in others, they have persisting difficulties with intelligibility. Auditory processing. People with autism, it's as if they need more time. And I sometimes wonder if they hear us like an out-of-tune radio. So I love a quote from Donna Williams's book, "I can hear the sounds," he said, "I just don't understand what people say to me a lot of the time." So people with autism have a lot of difficulty with what we call auditory perceptual skills. These are things that are so subtle but so important. Auditory memory. You have to remember the sentence of the person you're communicating with to be able to know how to respond appropriately. Discrimination, hearing the difference between sounds. Closure, we often don't hear everything someone says, but context or just the words around that word will help us to know what it was. And then blending, putting sounds together to make words or words together to make sentences. Receptive and expressive language and vocabulary. These are often affected in people with autism, and we refer to unusual language development often in people with autism, and even in adults with autism, unusual ways of communicating. So often we talk about idiosyncratic speech because it's idiosyncratic to that particular person. We also talk about stereotypical repetitive speech, scripting, which is just saying the same thing over and over again, and video talk and self-talk. Right. Then there's another whole list of things that people can struggle with. So echolalia is a common thing in autism, and it also happens in normal development. It also happens with those people who always repeat what you say before they respond. So it's like you need more time. And I remember one day so clearly working with a boy, and I'd been trying to get speech from him for months. And I just kept trying, turned around, packed my things away. And I suddenly thought, my gosh, he said the word, and he did. So I sat down and I waited. I tried again, and then I waited. And if you count to 5 or 10 waiting for a word, it's a long time. But he just started saying the words if I gave him enough time. And with time, that time wasn't so long. So very important to give people more time. But in autism, echolalia can also be a compulsive behavior. It's an enjoyment of the sensation of repeating. It can also be an attempt at reciprocity, trying to say something back, but not being sure what to say. And it can increase with anxiety or excitement. Pronouns are difficult for people with autism. Usually by adulthood, people will manage if they're verbal, but there still could be the odd one that's difficult. And I sometimes wonder if this is linked to facial recognition and knowing who's a man and who's a woman. I don't know, but the he and she are the most difficult. And then the they and the we and the them. So it also is affected by theory of mind and taking the other perspective. So often children will wave at me like this when they have autism, because that's how they see everybody else waving at them. Or that's how they see their hand when they are waving at someone else. Right, cognitive semantic deficits are things like being able to know that glass can mean a whole lot of different shapes and types. Or generalizing, that's a big problem for people with autism. They can do something perfectly in one situation or with one person, but they just can't transfer it. Then literal thinking. People with autism really struggle with abstract language. And idioms like raining cats and dogs can be really scary if you have autism and you take it literally. So I spend a lot of time explaining language to people with autism. And actually I get these regular messages from a 19-year-old I work with, and he asks me very politely if I can help him with this list of vocabulary. And many of the words are often related to his computer games, but today, one of the words on the list was autism. So we have been through that with him before because he has autism, but he needed to understand what autism is. And it made me think how difficult that is, because it's also not very concrete in the way we describe it. So if we look at, just under the literal thinking, one of the things that I find persists with people with autism into adulthood is a difficulty with what we call inferring. And it's something we as humans do so naturally, but it's how do you know something? How do you know that? So that's really tricky. Pragmatics refers to social communication, the use of language, eye contact, facial expression, reciprocal communication, dare I mention social distancing, how far we stand. And then prosody is referring to the intonation and rhythm of speech. So it's often in autism, people may have monotonous or high-pitched voice quality. They may be too loud or too soft. They may be over-precision of articulation or accents. I'm just having a sip of tea. Okay, so the next section is reaching through autism and looking at the world through their perspective. So autism is a way of being. It is pervasive. It colors every experience, every sensation, perception, and thought. If we look at the challenges people with autism have, sensory regulation, not just the 5 basic senses, but also problems with knowing where their bodies are in space, problems with balance, and that lovely word that Rosemary used in her talk, interoception, which means knowing or making sense of the feelings in your body. So people with autism struggle to know when they're too hot, when they're hungry, when they're thirsty, and even understanding the emotions that they feel to identify those. There is a huge amount of anxiety in people with autism. Also the emotional regulation, which goes with the interoception. People with autism can have extreme meltdowns, and they can go from 0 to 100 in seconds. They can just be so strongly triggered. And then the anxiety, which so often leads to OCD. And I see all kinds of different compulsions and different compulsive behaviors in autism. Ordering is a big one. I love the way they pack everything away, line everything up. Completeness and incompleteness. Often people with autism have to complete the whole plate or finish the entire glass. I mean, there are lots of humans, there are lots of us like that. And some people that don't want that last bit out. But mostly with people with autism, they want completeness. The puzzle must be complete. I never have sets with something missing, for instance. Cleaning and tidying compulsions, definitely. Checking and touching. I've seen so many different things. I've seen it a few times. Children will go to the level of a table or adults and touch these different surfaces, touching poles in the road, and it's an absolute need to do it. And then grooming compulsions, which can be self-injurious. So imagine having all those things going on in your mind and still trying to pay attention to what you're doing. So if we look at, I actually had such a funny story, a little boy the other day who I'm meant to be observing for features of autism. I've had my old cat has started sleeping outside my therapy room, and he was terrified the first time he came. And the second time he sort of got a bit better. And last week he started picking up little things off the carpet. And I thought, oh dear, must be OCD. And he put them in his hand and he took them to the cat to try and feed her. And I realized, don't read too much into things sometimes. Okay, so if we look at difficulty with planning and initiating movement, that is a really important thing in autism. I've worked with children who want their juice in front of them, but cannot move to get it unless you tap their elbow or give them a verbal instruction. In the extreme form of difficulty with planning and initiating movement, you would have what we call catatonia, and that's often caused by extreme stress and depression. Executive functions, organizing myself, prioritizing, paying attention to what I'm meant to pay attention to, planning my day, knowing what I'm meant to do and what I must do first and what I must do next. These are really important skills in day-to-day life that are often lacking in people with autism. And then I'm just going to show you 2 slides. This is just dysfunction of sensory integration and the emotional responses. Right, then just if we look at the brain differences in autism, over the years, I still see behaviors that I've never seen before, but there are really differences. So the physiological responses are exaggerated and they lead to dysregulation or meltdown. So often what you see in these children is with the unfamiliar, you'll see either fight, flight, or freeze. And I had a little boy I started with the other day who just literally ran back and forth and tried to escape, just that fight response. So that's usually based in anxiety. If we look at biological systems, just another thing around that, I have one child, if she gets anxious, she has very shallow breathing. Then I know that she's feeling anxious. And another boy who's 25 already, I mean, he left school a long time ago, but if I by accident mention his teacher's name, he instantly sweats, but it's just instant, and he pours with water on his face. And then I have another young woman who is 22, and if she's upset by a particular picture, she has a delayed vomiting reaction. So it can be really powerful. And I've got to be very careful what I do. So the other thing is the bladder and bowel control, the digestive system, the pain and temperature, which we spoke about, and the slow processing speed. Also knowing which sound to listen to or what to look at. It's very important in working with autism to look at the positives. And I was involved in a study with professionals who had to be in the field for over 10 years. And it was so wonderful because one of the questions was, what are the positive things about autism? So memory skills, a precise eye for detail. I have pictures that I've worked with for years and years, and a child will notice something in that picture that I've never seen. It is really fascinating. They have heightened senses, as we've discussed, which can sometimes be useful. They have an enhanced understanding of systems. So IT, definitely, animal behavior, engineering, electronics, music, theatre, and art, just to mention a few. And then when you are in a relationship with someone with autism, or when they're in a relationship with someone they trust, they are the most loyal human beings you will ever know. Right, how you can help. All humans need something to do, something to love, and something to hope for. And I think this is really true when we look at people with autism, adults with autism. So if I look at my work as a speech therapist with adults, my main focus is, or goal is, ongoing stimulation of their cognitive and language skills and communication skills and communicative interaction. And I think lockdown has taught us that humans need that. So it's also the routine of our sessions and our get-togethers, like an anchor in their week. And I really try not to change the time or the day unless I really ever have to. I also try, I'm going to just talk about this. I try to create a regular space for communication, a calm space. And if you're at home or in a care home, a group home, it would be good if you're going to work on communication or interaction to have the same little place where you sit every day, the same time, so that you make it part of a routine. So if you think of families or humans, often the time they talk to each other is at supper time at night or on the weekends when they go somewhere together. So it's good to have rituals and routines with people with autism. So I use a lot of choice boards, and I'm going to just stop sharing my screen for a bit. Okay, so that I can show you. Right. Okay, so I use lots of, all my toys are on a picture somewhere, and I have small ones we can keep next to the table, and I have big pictures on the wall. So I have choices of music. I have grids on my iPad. So I have lots of visual support and lots of picture choices. With the older children, we often make photograph books. So it can be just a simple book of photographs. It could be printed out pictures. And this is a wonderful way to have conversation, even with children, adults or grown-ups who are nonverbal. You can take pictures of them doing their real activities and talk about what they enjoy doing. I use different boxes of what I call cause-effect toys. I'll have a box of spinners or wind-up things or torches. And with adults, you can choose things that they're interested in and have little boxes of these toys. And then I have a whole grid on my iPad where they can make choices, whether people are verbal or non-verbal. And then I also do traditional speech and language activities. I use lots of different cards. This is great for autism. What are they asking? Little pictures and situations. Looking at picture absurdities. People with autism often like that kind of funny things that they can find the what's wrong with something. And then, of course, talking about emotions and feelings. So those are more the traditional things. I often use what I call conversation cards. So these are actually absurdity ones, but you can have ones of people doing things and discuss with the person what they enjoy or whether they would like to do something like that. I also work a bit on conversation. So if the person is verbal enough, we often work on things like, recently I was working with a young man on what's the difference between an insult and a compliment, because he kept telling his facilitator that his teeth were yellow and his breath was a bit smelly and he was a bit sweaty, and the facilitator was getting very upset. And the facilitator was actually the most gorgeous young man. So it was just about explaining that some things, and it's quite tricky, some things you don't say. And so it's quite a tricky area. So we talk about things like that and we practice social skills. I have little things like do conversation exercises. And when we used to run social skills groups, asking about themselves, what you could even make a journal, either of day-to-day what you do or your favorite foods and colors and places you like to go, doing little projects. I mean, I wouldn't do that in a speech therapy session, but if you work with a group of people, take something that they're interested in. And then I have another game called That's Life, looking at different behaviors and judging, you know, whether those behaviors are okay or not. All right, so I also do speeches. I get a little speech that we prepare about ourselves, and it can be so simple. And if the person can't speak, you can let them read it or look at it while you read it for them. You can also record it. So there are lots of different things that we can do, but it is important to look first at what the person's interested in. But I can tell you from experience that whatever you do enough of, that person grows to really love. So the routine is really important. Okay, so I'm going to go and I'm going to just sort of direct my screen around my office. Everything has an absolute particular place because a lot of the children who come here, so I can't even get to all the shelves, will have an object For one, it's my old Mr. Min in the cupboard in the bathroom. Another one, it's a Tipex. Another one, it's a particular toy. So objects are extremely useful in helping people with autism to feel more secure. And not, sort of all people with autism, and even, I suppose, normal humans, mainstream humans. Right, so I am going to go back to sharing my screen. Here we go. Oops. Right, and I just want to go down. I think I have to start my slideshow, resume slideshow. Okay. Right, so it may take days or months, a year or two even, but with enough support and consistent input, I believe these children can learn a whole lot, more than we can conceive for them sometimes. So it's important to presume competence, obviously within limits, and to keep our goals in mind. Our goals should be to develop a person's best potential, to encourage their independence, and to create a happy and calm life. I also think it's important to understand that autism and intellectual disability are not the same diagnosis. So although many people with autism have intellectual disability, that is not necessarily part of autism. The autism is the social communication, the sensory and emotional regulation, and the behavioral responses, the limited interests, those type of things. And then the scattered profile that we see in autism. It's so important to realize that, because often usually their verbal abilities are not their strongest areas, but they have so many other strong areas that we can work with. So we need to use interests and motivation, work at an appropriate level, reduce verbal overload, watch the tone of your voice, especially in praising, it can be too high-pitched. Give other communicative options, and give extra processing and formulation time. Oops. So we need to calm the brain. It's not about how I can make this person cooperate. It's how can I make this person feel safe if we want someone to learn. So we need to change the environment to fit the person where possible, and this is the low arousal approach. We need to create a familiar, predictable, and safe environment. Whatever we introduce should be small, gradual steps, small goals, low and slow. We need to minimize distractions, give structure and predictability, visual support, and empathy. And empathy is not feeling sorry for someone with autism, it's putting ourselves in their shoes. Until we know how to prevent autism spectrum disorders, the challenge is to help people compensate for them. Structure and empathy are the cornerstone of treatment, and through understanding sensory and emotional experiences and responses in people with autism, we are able to have more empathy and provide more effective treatment. People with autism want what we all want, to be understood for the way we are. Do not train a child to learn by force or harshness, but direct them to it by what amuses their minds, so that you may be better able to discover with accuracy the peculiar bent of the genius of each. Understanding the nature of the highly sensitive engenders respect, compassion, and tolerances for their differences, and promotes endurance in the caregiver. So this is actually my favorite saying, and it's the last one, and then I'm going to show you literally a 2-minute video clip. So I'll just read this one. These children give us something else entirely. And I think we've got to add adults there too, because I have the most wonderful adults with autism in my life. They shift our paradigms. They teach us new ways of loving and giving. They push our limits and extend our horizons. They demand from us a more unconditional and altruistic type of love. Okay, so often when I give a talk, I have these 4 very short little video clips, and each of them represents something. So when you're working with someone with autism, you need to work at the correct developmental level, whatever age they are. You also need to have hope. So the one video is just showing the difference when I shift the level of what I'm working at. The other one is about a boy who came from Nigeria when he was 2 and is now 20. I think his mom might be here, but to me, he is absolute hope. And he has come such a long way, and his mom's taken videos over so many years of his development. And then the other little video clip I use is showing the importance of motivation, how children respond. But the one I'm going to show you tonight is applicable to every person with autism that you want to develop a relationship with and help. And just think about it. I mean, any human and adult needs someone to talk to them every day, actually. And people with autism love that too, but they just need it in a more structured, routine way with lots of visual support. And often objects or pictures between us make it less threatening to communicate. So this little girl is to show us about, actually her mom is showing us about perseverance. So here we go. And she does talk now, by the way. I have to try again, hang on.
What's your dress? Is your dress fantastic? Say it. What's your dress? What's your dress? You just told me. Is it fantastic? Oh, wow there. What's your dress? Say the word again. What is it? What is it? What is it?
Bunny.
Fantastic. Fantastic. Fantastic.
Okay, so thank you, everybody. Des, we still got time for questions. I think we're going to be cut off in 2 minutes, so maybe we should go out and come back in for questions for those who'd like to.
Yes, I agree. We have about 2 minutes, so we can end, and then please rejoin and we'll restart. Yes, please ask some questions. That will be good. Or share, if you want to share something. There'll be a little bit more time, perhaps about 10 minutes or so.
Yeah, please, anyone who also has advice for other, and remember that our focus is mainly tonight, it should be more on adults with autism. So people who have advice about that, can please share. Okay.
Thanks. Okay. See you all now in a minute. Thanks very much. Does anyone have any questions, or you can either put it in the chat box, type it into the chat box at the bottom of your screen, or you can unmute yourself and ask a question, or if you have anything to share, any experiences. I'm going to ask Deborah to share with us, if she's willing to, how you explained or described autism to that 19-year-old. Asked you that question.
I start by explaining that humans all think differently and are made differently, which is something we've had to work on a lot already because he doesn't get a lot of humans. And then he comes from a family where it's been something that's been very openly discussed right from childhood. And so he often talks about, I have autism, which is quite interesting that he's now in our little personal interaction wanting to know what is autism. So I explain it as being people with different characters, actually, because I really see autism kind of as a character, part of your character. And I explain to him that it's to do with, I'll often try to give him examples of where he's struggled. So I'll explain things that, you know, I've known him since he was 2. And I will explain, do you remember when that used to bother you? Do you remember how difficult it was when you went to that school? So that's because, you know, socializing is difficult for you. And then I would explain to him about how, I mean, with him, because I know him well, I've got lots of examples. I try to give him concrete examples because for this particular question, we've already been through the theory of it, kind of. But if I was just, I think there often are people that ask, am I autistic? What is autism? And I think one just has to keep it as simple as possible and honest and answer the questions that are asked. So I would say, yes, you have autism. What does autism mean? Do you know that? Do you know? So first get what knowledge they have. And then say, well, you know, autism affects the way you feel. And you could go through all the different sensory areas. It sometimes makes it difficult to understand other people and their behavior. Sometimes you have that feeling you want to do something over and over again. So sometimes you feel very anxious. So really giving concrete examples of what autism means.
Thank you. I really like the end of that. One of the quotes on one of your slides said, the peculiar bent of the genius of each. I love that.
Yes.
I think if one looks deep enough and really considers the individual, perhaps not, it might not what we're wanting as a parent, you might find something very special inside there, even if it's just the, perhaps, I don't want to say just, but the ability to listen to music and really enjoy music. So if there's something they enjoy participating in or contributing to, I think that is the ultimate for us to discover as parents and support workers. And then maybe linking that to the fact that all humans need something to do, as Deborah said, something to love and something to hope for.
So I just want to say, Debs, you know, from my perspective, I mean, I think of some of the children who just so incredibly able at certain things that we've never imagined would be possible. And also just children with less ability who've grown up in very consistent homes where they take part in things. They're the best of any of the family at managing the housework stuff and their duties and responsibilities. So, and even just little things like the other day I was working with a young man who's 19 and he is totally nonverbal and he has been having speech therapy for 17 years. I'm sorry to say, but he has a lot of other communication. And I changed my glasses. I have these pink ones that I usually wear, and I've been wearing the pink ones all the way through lockdown on the Zoom call. And this particular gentleman, he sits on his own on Zoom. I never thought he would be able to do it. But this particular day, he started doing this to me. And I just knew exactly what it was. It was the wrong glasses. And we have this wonderful communication every time I see him now, because he's very insistent on that. So things that you don't think that someone else notices, I mean, those are very important things. So, okay, I think there's some chat boxes. You know, Deb, I want to just quickly tell that little story about happiness. So back to the goals, try and encourage independence in the home. Make that person as independent as possible, because they will have better self-esteem. But there was a family I worked for, and they were interviewing a carer called Z. And the mother explained that her children, or young adolescents actually, were not able to speak, and that they had autism. And at the end of the conversation, Z asked the mom, can they walk? And the mom said, yes, they can walk. And then her next question was, can they enjoy life? And her mom said, yes, actually, they can. And her third question was, and last question was, do they enjoy life? And I think that's such an important question to ask. Okay, so Deb, should I go to chat?
Yes. Are you able to, would you like to read the question?
Okay.
Yeah.
All right. This says, I can fully concur with what Debbie said regarding the amazing properties of music. My son enjoyed Joseph and his amazing Technicolor Dreamcoat. Family took the risk of taking him to a concert. At the end, he said, that was a nice show. That's fantastic. I still love Joseph and his Technicolor Dreamcoat. That's wonderful. Thank you. Okay, so let's go. That's one. Chat. I think that's it. Is there anyone else that wants to?
There was something further up from Heather.
Oh, wait. Oh, I see.
It's just a comment. Okay. Sorry. Yeah, it's a comment.
Very, very grateful for your talk, Deborah. The trouble with any therapies is sessions are only 50 minutes. What you've offered is understanding and solutions for everyday life. Things you can't always get in a session. So helpful for me as parent, and I'm sure for others. Thank you. That's wonderful. Thank you very much, Deborah. How can we improve their focus and concentration so that they can complete some activities? My first answer to that question is get them in a calm space. I try everything. I've even got this wonderful little oil of different geranium and calming oils. I'll use anything that even psychosomatically will help the child to feel calm. So activities to keep them calm, remember low and slow. Even if it's just getting them to sit on the chair for a minute in front of whatever you're going to do, maybe pot some little plants or whatever it is. Just for 2 minutes, that's it. And keep going back into that space and back into that activity and use something motivating afterwards and slowly build it up. That is how you get someone to focus, because people with autism can focus beautifully when they're interested. But if they're anxious and they're not used to something, they cannot. Their bodies don't allow them to. Okay, let's just see, there's another question. Okay, that was the one about the music, Debs, and that was the one,
yes.
I think we're done, yeah? Okay.
Yes, yes. I'm just going to comment on what Deborah has said to regarding the focus and the concentration to complete some activities. Or in our experience, and we have had quite a few coming through our services over the last, it's been about 8 years now. I found out if I can get to know the person and just observe them to begin with and get to know them in different ways of doing that, and find out what helps them to, first of all, be calm and to not be anxious, or what is it that's making them anxious, and address that. That is, I know from some of my teaching of 4 to 5-year-olds as well, if they're anxious and they're not in a good space, you're not going to achieve anything, actually. So you really need to get to know the individual and go with their interests and what might calm them down. They might need a foot massage, or sensory, as Deborah mentioned, maybe something sensory, or a suitable reward at the end of the activity. But I do think that they also need to enjoy the activity. And as Cheryl Blanche has said, there's more than one way to slice a carrot. So, or prepare a carrot. And we really need to consider each individual, what their abilities are, and what their strengths are, and what they enjoy. And I would say go with that. And then I hope that helps.
And just in terms of communication, with adults, your communication is around cooking in the kitchen with the visual support of the recipe, the outings for the day, the different duties. I mean, that is what you don't need to. And the sitting at the table is for perhaps have a little cup of tea and let's look at your journal, let's work on this, or let's talk about that. Because it's just some human social interaction.
Can I mention movement breaks? Perhaps Deborah can speak about that as well, but we find that really helpful. So that would mean for some individuals just going for a walk around the garden or around the neighborhood and then settling down again, or a jump on the trampoline or a swing. Even if they are adults, they might need that. But we have a stationary bike on our premises, and they might want to go and pedal the bike. What helps might change a little bit. I know someone who used to pedal the bike and now he doesn't want to pedal the bike anymore, but there are other things that we use for movement breaks. And it really helps.
Well, we all know that going for a little walk is very good for us. And funny enough, there was a school in Japan, I think they use that Higashi technique, and that was their thing. Between every session, they'd walk the children around and sort of marching around the school, but it boosts your serotonin. I mean, that's why people exercise. So it's a very good thing. And then often jumping, but it's also the OT's, good at guiding you as to what it's knowing your child as well, what kind of input they're craving, and that can fluctuate as well. Okay, Debs, maybe we should end off.
If there are no more questions or comments, thank you to everybody for joining us. There is something here. It's in the chat box. My son avoids using words. It disappeared. He prefers to hold your hand and show you what he wants. Does that improve or change with practice, or it changes with brain development?
Okay, so depending on how old your son is, brain development is a long, slow process in autism, and we do not give up on wanting speech. I mean, that is something that often I see developing really late. But probably the reason your child pulls and points is that he's not really able to produce the words in that moment for that function. So often we see people with autism, they can imitate a word perfectly, but they just can't initiate the communication in that moment. So for now, you just model the words and you encourage the gesture. And if he can say it, he will, but then maybe try to demand a little more, like a picture or touching on a picture rather than just pulling you. And never give up, always say the word, also get down on his level, let him watch you. So you just keep trying, but it's partly what we do, and it is very much the unfolding of the brain. I mean, they talk about autism being a developmental disorder, and that's why, because it changes. Okay. So there's always hope.
Yes, very important. All right, thank you, everybody, for joining us. Some people know us, some people haven't met us before, so very nice to meet everybody, and thank you for being part of these talks. If you would like to email us, info@adultswithautism.org.za with comments or suggestions for future talks, then we will definitely consider what you have to say. Thank you very much. And thank you very much, Deborah, for all that insight based on your experience and all your knowledge. Thanks for sharing, everybody. Have a good evening. Bye-bye.
Thank you for listening. Bye, everyone.
Thank you.